الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Indicators of MCH care by Professor Mahmoud Hani Sulaiman. Commonly used indicators are 1. Maternal mortality rate. 2. Mortality occurring during infancy. They are 4. Perinatal mortality rate, neonatal mortality rate, post-neonatal mortality rate, infant mortality rate. So they are 4. Number 3, childhood mortality. They are 3. 1 to 4 year mortality rate, under 5 year mortality rate, child survival rate. Maternal mortality rate. Maternal death equal death of a woman while pregnant or during childbirth or within 42 days of termination of pregnancy. Maternal death, it is the death of a woman while pregnant or during childbirth or within 42 days of termination of pregnancy, irrespective of site or duration of pregnancy from any cause related to or aggravated by pregnancy or its management, but not from accidental or incidental causes. To explain this, death of a pregnant woman due to suicide or homicide or accident in street, factory or home is not a maternal death. However, death of a woman during pregnancy due to worsening of a pre-existing disease or death due to anesthesia during cesarean section constitutes maternal death. Maternal deaths of a given country during a given year is estimated per 1,000 live births and expressed as maternal mortality rate. Maternal mortality rate equal number of maternal deaths per 1,000 live births. Maternal mortality ratio is annual number of maternal deaths per 1,000 deliveries, not for live births, but for deliveries. In developed countries, it is estimated per 100,000 live births because maternal mortality rate is very low. Late maternal death is death of a woman from 43rd day of delivery to 1 year. Late maternal death. Puerperium is 42 days period following childbirth. It is 6 weeks during which uterus undergoes involution. So late maternal death is the death after puerperium. So the formula for maternal mortality rate is number of deaths of mothers during pregnancy, childbirth, or within 42 days of delivery in a given area during a given year, divided by total number of live births in the same area and year. This is multiplied by 1,000. Magnitude of the problem. Globally, nearly 5 lakhs, lakh is 100,000. So nearly 100,000 maternal deaths per year. About 99 occurs in developing countries and hardly 1% in developed ones. Next to Africa, 2.5 lakhs. South Asia has highest MMR in world. It is high in India, nearly 150 maternal deaths per day, 1 every 10 minutes. For every maternal death, there are 14 perinatal deaths. For every maternal death, there are perinatal deaths, and many women experience serious complications. Most of these are preventable. Most of these are preventable. It is one of leading causes of death among women of reproductive age. Causes of maternal mortality. Causes are grouped into obstetric, medical, and social. Obstetric causes mainly antenatal, intranatal, and postnatal. Obstetric causes antenatal, intranatal, and postnatal. What are the antenatal causes? They are toxemias, hemorrhage, placenta, multiple pregnancy, abortion, followed by bleeding, ectopic pregnancy, and criminal abortion. So, toxemia, either preeclampsia or eclampsia. Antepartum hemorrhage, placenta previa, appropriate placenta, multiple pregnancies, incomplete abortion, then bleeding, ectopic pregnancy, and criminal abortion. Causes of maternal mortality continued. Intranatal causes: rupture of uterus, prolonged labor, obstructed labor, anesthetic shock during cesarean section, amniotic fluid embolism. Intranatal: rupture of uterus, prolonged labor, obstructed labor, anesthetic shock during cesarean section, amniotic fluid embolism. Postnatal causes are puerperal sepsis, postpartum hemorrhage, and thrombophlebitis, in this order: puerperal sepsis, postpartum hemorrhage, thrombophlebitis. Causes of maternal mortality continued. Medical causes: anemia, malnutrition, then associated underlying systemic diseases as cardiac, respiratory, and renal diseases. Social causes of maternal mortality. These are not causes of maternal death, but they are predisposing factors making pregnancy and childbirth risky venture. These are poverty, illiteracy, ignorance, overcrowding, poor living conditions, lack of sanitation, illegitimacy, lack of health care services, other customs like early marriage, teenage pregnancy, too frequent and too many pregnancies. Reduction of maternal mortality rate. First, efficient antenatal care, then efficient intranatal care, then efficient postnatal care. Efficient antenatal care as early recognition, registration of expectant mothers, regular antenatal check-up, antenatal investigations, detection and referral of high-risk mothers, antenatal advice including warning signals, antenatal services like immunization and nutritional supplementation, distribution of IFA tabs, efficient intranatal care, provision of safe delivery by a trained person, observing 5 cleans, identification of danger signals, and giving special attention institutional deliveries for high-risk mothers. Efficient postnatal care through promotion of speedy recovery by regular postnatal check-up, postnatal advice, encouraging early ambulation, provision of emergency care by blood transfusion. Reduction of maternal mortality continued. Family welfare services through counseling of newly married couple not to conceive before 20 years and after 30 years of age, spacing for more than 3 years between pregnancies, limiting number of children preferably to only 1. Health education about nutrition, drugs, exercise habits, personal hygiene, about taking treatment for illness, etc. Other services encouraging female literacy and socio-economic development of community through active community involvement. Lastly, identification and investigation of every maternal death. In 2017, maternal mortality ratio for Egypt was 37 deaths per 100,000 live births. This is the maternal mortality ratio. Between 2003 and 2017, maternal mortality ratio of Egypt was declining at a moderating rate. It shrank from 57 deaths per 100,000 live births in 2003 to 37 deaths per 100,000 live births in 2017. From 57 deaths to 37 deaths. This is moderate declining. Mortality during infancy. Different components of mortality occurring in and around infancy are represented diagrammatically as follows. This is the infant deaths on your right side. They are either perinatal deaths and neonatal deaths. Perinatal deaths is either neonatal deaths either late fetal deaths, stillbirths, early neonatal deaths, late neonatal deaths, post-neonatal deaths. So they are stillbirth rate, perinatal mortality rate, neonatal mortality rate, post-neonatal mortality rate, and infant mortality rate. Stillbirth or late fetal death is one in which fetus is born dead after completion of 20 weeks of gestation but before full term, 40 weeks. For international comparison, WHO suggested that weight of fetus at 28 weeks of gestation is taken as 1,000 grams. Stillbirth is expressed per 1,000 total births. Stillbirth rate is defined now as number of fetal deaths weighing more than 1,000 grams at birth in a given area during a given year. It is expressed per 1,000 total births, stillbirths, زائد live birth. Formula: stillbirth rate equal number of fetal deaths weighing over 1,000 grams at birth divided by total births, that is to say total births, that is stillbirths weighing more than 1,000 grams at birth. This is multiplied by 1,000. Causes: it is either maternal, placental, or fetal. Maternal: toxemia, diabetes, infection, RH incompatibility, premature rupture of membranes, antepartum hemorrhage. Placental: anomalies of placenta, anomalies of cord. Fetal malformations, twins, triplets, quadruplets, hydramnios. Perinatal mortality rate. Perinatal mortality rate, PMR, is number of deaths of newborns during perinatal period. Perinatal period is period from 28th week of gestation to 7 days after full term. So perinatal deaths include late fetal deaths, stillbirths, and early neonatal deaths. Deaths in 7 days of birth. For international comparison, denominator is total live births and not total live and stillbirths, because in many areas stillbirths not documented. Perinatal mortality rate is a very sensitive indicator of obstetric and neonatal care, i.e. quality of health care to mother and newborn. The cause of including both stillbirths and early neonatal deaths under one term as perinatal death is that factors responsible for these two types of deaths are often similar. These factors, when severe, lead to stillbirth, and when mild, result in early neonatal deaths. So the formula for perinatal mortality rate is number of stillbirths and number of early neonatal deaths weighing over 1,000 grams at birth divided by total number of live births weighing over 1,000 grams multiplied by 1,000. Causes of perinatal mortality rate. The causes of perinatal mortality rate are grouped into medical and social. The medical causes grouped into antenatal causes, intranatal causes, and postnatal causes. Antenatal causes, all high-risk mothers. Intranatal causes, obstructed labor, prolonged labor, birth injuries. Birth injuries include cranial fractures, visceral rupture, massive subdural hematoma. Birth infections, birth asphyxia. Postnatal causes, neonatal causes are acute respiratory distress syndrome, low birth weight, respiratory and alimentary disease, congenital anomalies, and neonatal tetanus. Causes of perinatal mortality rate continued. Miscellaneous causes, either placental, fetal, or social. Placental causes, placenta previa, placental insufficiency syndrome, placental anomalies, abruptio placenta. Fetal causes, fetal malformations, multiple pregnancies, hydramnios. Social causes, these are all predisposing factors, same as for maternal mortality. Prevention of perinatal mortality rate, see under infant mortality. Neonatal mortality rate. Neonatal deaths are deaths of newborn occurring within first 28 days after birth. It is expressed in numbers per 1,000 live births during a given year in a given area. So neonatal mortality rate formula equals number of deaths of newborns within first 28 days of birth in a year divided by total number of live births during the same year multiplied by 1,000. Causes, see under infant mortality rate. Neonatal mortality rate is inversely proportional to birth weight. Lower the birth weight, higher the neonatal mortality rate, and vice versa. All causes resulting in low birth weight, that is to say endogenous factors, can result in neonatal mortality rate. Prevention of neonatal mortality rate, see under infant mortality. Prevention of neonatal mortality rate, see under infant mortality, as we said, whereas NNMR is influenced by endogenous factors, PNNMR is influenced by exogenous. This PNNMR is more among girls than among boys because of preferential care for male children. Causes, see under infant mortality. Formula for PNNMR, number of deaths of infants between 29 days and 1 year of age in a given year divided by total number of live births in the same year multiplied by 1,000. Infant mortality rate. Definition: infant mortality rate is defined as number of deaths of children less than 1 year in a given area during a given year per 1,000 births. Again, definition of infant mortality rate. Infant mortality rate is defined as number of deaths of children less than 1 year in a given area during a given year per 1,000 live births. Importance: infant mortality rate is universally considered as most sensitive indicator of health status of a country. Most sensitive indicator of health status of a country. It also reflects cultural, milieu, and socio-economic development of country. It reflects quality of MCH care. Thus, it also reflects people's attitude toward value of human life. No single indicator conveys so much as the infant mortality rate. It is very important. Infant mortality rate continued. Among all mortality rates, infant mortality rate deserves special mention because it is the largest single age category mortality. Deaths occurring during infancy are due to peculiar set of conditions to which adult population are not exposed. It is affected directly by health program. Formula for infant mortality rate, it equals number of deaths of infants in a given area during a given year divided by total number of live births in the same year multiplied by 1000. Magnitude of the problem of infant mortality. Infant mortality rate is a global problem. It is very low in developed countries and high in developing countries. It is, for example, maximum in Sierra Leone 113 and is minimum in Iceland 1.6, Singapore 2.1, Japan 2.4. Further reduction of infant mortality in developed countries is difficult because it depends on preventing congenital abnormalities. Decline of infant mortality rate in developed countries is mainly due to improvement in quality of life. Improving quality of health services played a secondary role. Magnitude of the infant mortality continued. This is reverse in developing countries. The infant mortality rate for Egypt in 2019 was about 15 deaths per 1,000 live births. In Egypt was in 2019 15 deaths per 1,000 live births. A 3% decline from 2018. The infant mortality rate of Egypt in 2018 was 15.6 deaths per 1,000 live births, a 4% decline from 2017. For example, in India, infant mortality was very high in beginning of century, 200 per 1,000 live births. It started declining slowly and reached 120 at time of middle century, 64 during 2002, 47 during 2010. In spite of significant decline, it is still very high compared to developed countries. Rate of decline is very slow in India. Over past years, Egypt recorded important improvement of child and maternal survival and health. Between 1988 to 2014, under 5 mortality rate declined from 108 to 27 child deaths per 1,000 live births. More than one half of these deaths occurred in first month of child life. Progress in coverage of prenatal care in Egypt was obvious. In 2014, around 90% of mothers underwent antenatal care checks during pregnancy. About 90% of mothers underwent antenatal care checks during pregnancy. 83% of them had antenatal care on a regular basis. Among all births, 92% attended by skilled birth attendant and 87% took place in health facility. It is a good ratio. As for immunization rate, 92% of children aged 18 to 29 months were fully immunized in 2014. So 92% of children fully immunized. Children received complete vaccination against TB, measles, diphtheria, pertussis, tetanus, and polio. This is very good. Causes of infant mortality grouped into A. Causes of neonatal mortality: low birth weight, hypothermia, birth injury, obstructed labor, birth asphyxia, congenital anomalies, neonatal tetanus, acute respiratory distress syndrome, diarrheal diseases. These are causes of neonatal mortality. So, causes of post-neonatal mortality are acute infections, respiratory and diarrheal disease, malnutrition, congenital anomalies, and accidents. Predisposing factors of infant mortality are either biological, social, and cultural. Biological factors predisposing to infant mortality: birth weight, birth order, birth interval, multiple births, fertility, family size. Birth weight: lower the birth weight, higher the infant mortality. Age of the mother: younger age of mother, higher infant mortality. Birth order: infant mortality is highest among firstborn and lowest among secondborn. Birth interval: shorter the birth interval, higher the infant mortality. Multiple births, twins and triplets. Fertility: higher the fertility, higher the infant mortality. Family size: higher the family size, higher the infant mortality. Predisposing factors for infant mortality continued: social factors, economic status, literacy level, living condition, broken families, illegitimacy, lack of sanitation, sex of child, quality of health care. Again, social factors are economic status, literacy level, living condition, broken families, illegitimacy, lack of sanitation, sex of child, quality of health care. Predisposing factors of infant mortality continued: cultural factors, feeding practices, customs, and brutal habits. Feeding practices: correct feeding practices with exclusive breastfeeding during first 6 months, followed by proper weaning, reduced infant mortality. Customs of early marriage and teenage pregnancies. Brutal, such as cutting the umbilical cord with knife, application of dirty cloth to umbilical stump, increases infant mortality. Prevention of infant mortality rate. Since infant mortality is a multifactorial causation, preventive measures are multiple. Under ideal conditions, no infant should die except those who are born with congenital irreparable anomalies. The various measures of preventing infant mortality are grouped into two broad groups: general measures and specific measures. General measures for prevention of infant mortality and specific measures for prevention of infant mortality. General measures for infant mortality prevention. These consist of improving in socioeconomic, as improvement in female literacy, improving in living conditions, sanitation, especially safe water supply, avoiding early marriages for girls, health education of mothers regarding feeding practices, weaning practices, and child rearing practices. Specific measures for infant mortality prevention, either measures related to mother or infant. The measures related to mother are efficient antenatal care, 2 doses of tetanus toxoid to detect high-risk mothers, efficient intranatal care, Prompt management of complications. Again, those related to mother are efficient antenatal care, 2 doses of tetanus toxoid, detect high-risk mothers, efficient intranatal care, and prompt management of complications. Those specific measures related to infant are care of newborn, care of at-risk newborn, growth monitoring, oral rehydration therapy, breastfeeding, immunization, family planning. Those related to infant are care of newborn, care of at-risk newborn, growth monitoring, oral rehydration therapy, breastfeeding, immunization, and family planning. Mortality during childhood. 1 to 4 year child mortality rate defined as number of deaths of children between 1 to 4 years of in a given area during a given year, expressed per 1,000 mid-year population of same age. It is the probability of a child dying between first and fourth birthday. 1 to 4 year mortality rate is a refined indicator of social situation of country than infant mortality, and here is the formula for 1 to 4 year child mortality rate. Causes of this 1 to 4 year child mortality are diarrheal diseases, respiratory infections, malnutrition, accidents, and congenital anomalies. Groups of home accidents identified. They are fall from staircase, balconies, suffocation, burns, and poisoning. Accidents. Child survival index or child survival rate is percent of children surviving up to age of 5 years, and this is the formula for child survival index. Neonatal mortality rate 11 deaths per 1,000 live births. Infant mortality rate 17 deaths per 1,000 live births. Child mortality rate 20 deaths per 1,000 live births. Life expectancy is 72 years. Health expenditure as a share of GDP is about 5%. Health expenditure per capita 126 US dollars. HIV prevalence 0.1%. Incidence of TB 12 cases per 1,000 people. Female obesity prevalence 41%. Male obesity prevalence 22.7%. At last, we will talk about rights of a child. The policy recognizes children as nation's supremely important asset and declares that nation is responsible for their nurture and solitude. The major issues which need urgent attention are child labor and essential education. According to UN Declaration, for which government of Egypt is signatory, rights of child are right to develop in atmosphere of love, affection, and security of parents. Right to enjoy benefits of social security as housing, medical care, etc. Right to free education, right to play and recreation, right to name and nationality, right to special care if handicapped, right to receive protection and relief in times of disaster, right to develop in healthy manner in condition of freedom and dignity, right to be brought up in spirit friendship among people, right to enjoy these rights irrespective of race, color, sex, religion, national or social origin. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.